Hello. So the question comes is that how do we know that you have heart disease? First of all, some of the risk factors that guide us to know whether you have a probability of having heart disease or not. That includes a lot of risk factors, your genetic makeup. How do you know genetic makeup? By knowing the family history. This is one of the very important factors. And by a cumulative percentage of all the risk factors, we come to a conclusion that whether you have a disease or not. Uh, I will not be hesitating to let you know that most of the time we get fooled by these erroneous results. And why is it so? Because uh, a lot of factors we do not know contribute a lot, and unfortunately we do not give significant importance to them, so that may be a factors for our erroneous conclusion that this person may not be suffering from heart disease, ultimately uh, comes with a heart attack. So it's high time that we evaluate in details, not the way we used to do. uh, it is always better to go for the diagnostic test rather than assumption, and this is not the year of assuming something which we do not know. So it is better to go for the tools, the diagnosis we have. In today's world of evidence-based medicine, let's find the evidence. That's what my take on is. Well, next question is whether eating eggs, including the yolk portion, is good or not. Yes, that's an important question we often face. So my take on is that if you're eating one egg in a day, so eat the whole egg. It doesn't matter, because your egg contains this 55 gram of one egg contains almost 250 to 300 mg of cholesterol in your yolk, and this has a large number of amino acids, proteins that are very important for your health. So if you're taking one egg in a day, so take the whole egg. This is very important for you. That gives a significant nutrition, significant energy, and large number of important nutrients. So don't miss it. If you're taking three, four, some people take it, then it is wise not to take the yolk. So for one egg, you take the whole egg, and from next egg onwards, take the albumin portion, the white portion. That is helpful. Yes, some persons may be suffering from familial hypercholesterolemia. In that scenario, strict restrictions are required. But most of the time, the people are concerned about they're taking whole egg. They're taking one egg in a day, so it is prudent to take whole egg again. Okay, thank you. Hypertension is one of the important factors, and often people ask me uh, regarding the facts that how do we monitor blood pressure in our home. So home BP measurements is very important. I always say to my patients to record your blood pressure when you are relaxed, when you're cool at your home, and do record it in your diary, in your home book, and keep it in a proper way and come with that so that you can understand, because office BP measurements may not be always right. Second issue is that which instrument they will use. Often they ask if the digital is okay or not. Yes, if you have no other options, then of course digital is very standard, you can go in. Remember, calibration is very important. Standardization, that we call. How do you do standardization? When you are getting high BP in your machine, do record your husband, your wife, your father, your mother, your son, whether your daughter or any relative and that are close or nearby, whether it is also giving the high record for them also. But it's not going not giving high results, then probably you are suffering from hypertension. You have to admit it. It's not the machine is wrong. And always do check for both arms, and there will be little difference that is physiological. And again, you have to do this monitoring and checking of your machines by measuring a person who is not known to be hypertensive and recording a normal BP for that, and that's the way you can check the machine is okay or not. 24 hours blood pressure measurements. Nowadays we do have these facilities in almost all the centers, is very important because your average blood pressure is very important. So these are the two things that I would like to bring to your notice, that home BP measurements and 24 hours BP measurements. Please go for it. These are very important.